Good afternoon, everyone. This is Diggs. I hope you're having a fantastic Saturday today. We have kind of a special opportunity here. We are going to be here with Dr. Chow. He is one of the people who has done a study on COVID-19 in Orange County in California. And we have the chance to sit down here and talk to him about the work he's done. He's a regular viewer of ours, and he wanted to try and get the word out to Twitch and YouTube and get the word out to as many people as possible. So without further ado, I'd like to introduce Dr. Chow. Dr. Chow, how are you?
Good. You can call me Dan. Thanks, though.
I can call you what?
You can just call me Dan.
Dan? All right. So Dan, tell us a little bit about yourself.
So I am a neuroradiologist. I am an assistant professor at the University of California, Irvine. And I am a part-time clinician and part-time researcher.
Wow.
And also a gamer.
Clearly, right? I think there's actually a lot of people who are gamers in your field, right?
Oh yeah, especially in my age group.
So why in particular did you want to try reaching out in terms of YouTube and Twitch to people?
I just think that times are changing a little bit, and I think that this is just one of those media that are overlooked. If you look at in terms of streaming and content, Twitch and YouTube, and we represent a significant demographic that oftentimes journal articles or traditional media outlets just don't necessarily reach.
Yeah, I completely agree with you, and I think there's so much information out there, it can actually be overwhelming. So to actually hear it from a clinician and someone who's actually been a part of the study is really cool, I think.
Yeah, this is the first for me.
Yeah. Can you tell us just a little bit about your study?
Yeah, so one of the things that we've been looking at is we're actually doing some AI research, and in the process, we were collecting data on our COVID patients. And one of the things that we started observing very quickly was that there were certain populations that were being disproportionately affected by COVID, and specifically minorities and also patients who live in communities of disadvantaged socioeconomic status.
So most of your information that you gathered really focused around sort of median income of people and some more demographic information, correct?
Correct. So we're looking at the demographics of our patients and the communities that they're coming from.
And so as I was reading this article, most of the information that you gathered is from people who actually came in, correct, and got COVID-19 tests from you guys?
Yes, that's correct. So this is our cohort of patients from UC Irvine.
And then this chart that I have in front of me has examining the trends in median income right now. Can you sort of tell me what this is showing us over the course of your 6-week study?
Yeah, so if you look at, week 1 was defined as when we had our very first patient of COVID. And around week 2 is when Governor Newsom had his shelter-in-place order. And as you can see that with time, it really is only one income bracket that is rising, and it's the lower income bracket. And we define the lower income as being 80% below the median income for Orange County. And while it's leveled off for middle and upper income, it's really dramatically risen in patients who live in low income neighborhoods.
Just for some perspective right now, what week are we in currently?
For us, we just finished week 8 and we're going into week 9.
Are you considering to see the trend increase through that, or is it sort of lowering the curve, so to say?
I think I showed you one graph earlier when we were chatting beforehand, and I think that there are some trends that are leveling off and some trends that are still increasing, which is concerning.
Yeah, that is that's really concerning. So in terms of like what you guys are focusing on, do you think we need to be doing more outreach to low-income neighborhoods?
Yeah, and it is really, it set up a perfect storm, because if you think about it, folks in low-income neighborhoods, these are our frontline workers. These are the people who are, at our grocery stores. They are typically more front-facing, and so it really is this perfect storm where we have folks who are already in the low-income neighborhoods who are already not as economically advantaged, and now they're also the front-facing workers who are getting these infections. So I do think that that's a very important public health discussion.
Yeah, that's pretty crazy. And not only tracking by income, you guys also track by ethnicity as well, correct?
Correct. And this is something that we looked at, and we looked at specifically the top 3 ethnic racial groups in Orange County, and we can see that it really is folks who identify as Hispanic and Latinx who are really dramatically rising the fastest and rising the most.
Just to kind of ask a question here, just for clarification, because I think there's a lot of people out there. When I initially posted this information in our Discord and I was talking about it on Twitch, someone immediately went to probably a pretty common reaction is like, diseases can't be racist. But can you talk a little bit about why we're seeing that disproportionate effect on the Hispanic and Latinx community?
Yeah, I agree that diseases are not necessarily racist, but if you think about it, it's your ability to get the disease. So if you have someone who is able to shelter in place and work from home, they're less likely to get the disease because they're not out there, versus someone who is maybe in a lower socioeconomic background, who has to work to be able to provide for their family, who works in a position where they're a front-facing worker, they are having their exposure. Also, you think about the living status. If you are in a more densely crowded neighborhood, if you're in a more densely crowded apartment, if you are sharing an apartment with other family members, in order to make rent, and also everyone else in that family is also a front-facing worker, you just have so many more opportunities for infection. Versus if you have a family who is able to shelter in place and not necessarily go out. That's why you see it more in certain. You can see it more in certain ethnic groups.
And taking a look at this, of course, is highlighting kind of all the differences. Can you kind of talk about these graphs, which talk about relative income compared to over the couple weeks? And I think, does this also have like cases? Is this severity of cases over income right here?
Oh no, this is just exactly what your point is that if we look at our trends, so all the light blue ones are new cases from patients who live in areas above the median income, and then the dark blue are new cases from patients who live below the median income. And so really, we're seeing that this disproportionately affect Hispanic Latinx who live in low income neighborhoods. That's where we see the greatest rise.
And there's a connection. Is there a connection to severity as well in these low income neighborhoods?
Our study wasn't powered enough to do so, but if you look at the nationwide data there is, especially coming out of New York, we're finding that minorities specifically have a higher chance of critical disease or critical illness.
Is there a specific reason for that, or is it just because of that lack of access?
Part of it's lack of access, but one of the things that we do know about COVID is that if you have multiple comorbidities, meaning other illnesses such as hypertension, diabetes, obesity, you tend to do worse. And we do know that those comorbidities, due to socioeconomic status, tends to affect minorities disproportionately.
And one of the things you called out in your study, which I thought was great, I know a lot of people are looking at this and they're kind of like, well, why aren't there any black people on this? Can you kind of talk about that?
Sure, and that's in relation to our Orange County statistics. African Americans and Black peoples represent, I think, between 2 to 3% of Orange County, and so we did look at them. It's just that it's hard for us to make statistical significance because they're a smaller proportion of our county. But if you look at the data coming out of, say, Michigan or New York, we're seeing the same trends there, where we're seeing very, very heavily affecting the Black and African communities over there. So this is really something that I would say is that disproportionately affecting folks from lower socioeconomic status and minorities, unfortunately, right now.
And then I thought these charts were very interesting when I was looking at all the information you guys had gathered, because you actually connected it to household size, education, working from home, and health insurance. And it looks like you see a lot of these factors actually increase as well, their potential for getting the disease. Is that correct?
Yeah, correct. And to be fair, this is in relation to the census tract of the neighborhoods. So all the census tract are about 2,000 to 4,000 patients per tract, and we can see that over time, if you look at the top left, patients are coming from denser and denser household sizes. If you look at the top right, you're having higher levels of non-college education or lower education levels. If you look at the bottom left, it's less likely to be someone that works from home. And the bottom right, to me, is the most disturbing because increasingly these are patients who don't have health insurance.
Yeah, I think that's really concerning. In terms of this chart right here, this is basically a breakdown of how many cases per each in your study, correct?
Kind of, yes. So let me walk you through this. On
Sure.
the very left, in that light blue, that is the
Mm-hmm.
county statistics for what Orange County is made up. So Orange County is 40% white, Asians are 20%, and Hispanic peoples are 30%.
Okay.
In theory, if you look at our critical patients and sick patients,
Mm-hmm.
everything should be matching the county statistics because there should be no real difference.
Right.
But that's not what we see. What we see is that folks who are identified as white, non-Hispanic, they're only about 20% of our critical patients, versus our folks who are Hispanic, they are significantly higher, almost 50% of our critical patients. And so that is the disparity that you really see, is that they're not matching the county profiles.
And then, of course, at the bottom of this is talking about your data and your chi-squared. Can you kind of talk about what chi-squared is and why it's relevant for your data?
Yeah, so chi-squared from a statistical test is does the actual value matches the expected values. So
Yep.
in this case, the expected value would be the county percentage. Everything, if the chi-square was not significant, everything would line up with that light blue.
Yep.
But because it is significant, it's because everything does not line up that light blue. So the actual values do not match up with the expected values, and that is how we know that it's statistically significant.
So it essentially proves the viability of your results, correct?
Correct.
So the number of new cases is rising to the fastest within low-income patients and demonstrates an exponential growth pattern. And of course, there's an equation. Is it PERT that we talk about in terms of the exponential growth?
I don't necessarily think the equation is as important now, because
Mhm.
as we go into week 7 and week 8, it's no longer exponential in those groups. It's now moving to more linear, and that's what you expect.
Mhm.
In the early stage, you expect this dramatic increase, and then it will plateau off. And so it's still affecting low income and Hispanic slash Latinx the most, but the rate is not as fast as before.
And then we're talking about how this kind of explains the differences in distribution of cases between weeks 1 and 2 and 4 and 5 with the shelter-in-place order. Is that accurate?
Yeah, that's accurate, and that's how we did our stats, because week 1 and 2 is we hadn't started sheltering in place, and weeks 4 and 5 is when the post-shelter order.
And then when looking at ethnicity alone, only the Hispanic population is increasing. However, when looking at both Hispanic and median income, it is specifically the Hispanics who live in sort of tracts that are below the median income that are impacted, correct?
Correct, and that is what we saw in our initial 6-week cohort, is that was the group that was growing the fastest.
And that seems to match the trends that we're seeing in studies across the United States. Is that correct?
From my understanding, without having delving into all the specific studies, we do see that disproportionately minorities and low and disadvantaged patients tend to be facing the brunt of this right now.
So increasingly, patients are coming from communities of no college education, so a potential metric of sort of unskilled or essential workers, and highlight the risk of getting the disease. They're coming from larger household sizes. The lower proportion of work from home is sort of reflected in the inability to shelter, and then a higher proportion of no insurance.
Correct.
And then relative to the county, we're seeing discrepancies in the number of cases per 100,000 with respect to ethnic groups and relative proportion of critically ill patients, right?
Correct.
So overall, if you had one message to sort of give everyone out there right now, what would it be?
I think that this is really one of those perfect storm situations where you have patients from a lower socioeconomic status who have lower healthcare coverage, and in the population that we know has multiple medical comorbidities. Essentially, the disease is rising in a group that cannot shield itself by sheltering. Our common communities are poorer and more vulnerable, and it's a really sad thing. And I think that this is a public health issue that needs to be looked into.
Do you think, I know that California has a plan to reopen, and I know for Washington State, they're looking at reopening on May 31st. Do you think it's too soon to reopen right now?
And I'm going to leave that to, I know at least, Governor Newsom and he's definitely from watching his media briefs, listening to clinicians' advice, and I think that their plan is to slowly open up California, and I think every state is going to be doing that a little bit differently. I think one of the things that we'll be seeing is as we open up through the phases, do we see a new surge or is it still under control? So I think that's something that we're going to see in the next few weeks.
Is there anything we can do to support these communities that might be going through this or might not even know about this?
I think that's a really tough question. I think, one of the things that we're trying to do is really I know some of our colleagues are trying to really outreach to these communities. One of the things that is really on our minds is that, while we're also working on treatments with vaccines and antiretrovirals and so forth, one of the things that is really important is to take care of our patients' comorbidities. We know that having multiple medical conditions, if you have those, that's not good for the disease. So things like, finding ways to improve obesity, diabetes, hypertension, metabolic syndrome, all those things are important things that, have not really been looked at. And I think those are really important questions to also look at this. And so while this is very much an infectious disease issue, this is also a public health issue.
Finally, is just before we come to our end here, is there anything else you really think that we need to be talking about here that we didn't touch on today?
No, I think we hit all of the main points, and this is interesting because this is my first time doing a kind of a podcast streaming on a game thing, so this is definitely new territory for me.
Yeah, no, I'm hoping that we'll hopefully be able to get this shared out, and I hope that we'll be able to get the word out. We will be putting all of the resources down below in the description of this YouTube video. And for those of you on stream, you should already have access to the article. It should be posting every 5 minutes for you, so you can go and read it and see the full information from this study if you're actually interested in the percentages and the amount of casework that we did. For those of you on YouTube, thank you for listening and have a great rest of your day. And for those of you on Twitch, we are going to be continuing here with Dr. Chow for a little bit. He is going to be answering some questions for you. Dr. Chow, thank you so much for joining us.
Yeah, thank you again for having me.